Hello again, everyone. Mark Hackle, Macomb County Executive, Deputy Executive John Paul Ray. I'm just giving you some of the facts and updates on what's going on with the COVID virus here. Before we get to those numbers, you'll note that there is, the need apparently to wear masks when you're inside. So the question is, what type of masks that we're talking about? The actual recommendation is kind of like a cloth bandana, if you will. Just kind of making sure that it's up over your nose and your mouth. We have them in and around our building. If we start getting within 6 feet of one another, and John Paul and I are clearly, at a further distance than that. But even the low-grade masks, anything but the N95s, they're recommending people not wear those. But again, the low-grade masks are helpful so that you're not, getting somebody sick as a result of this COVID.
Mark, Executive Order 2020-59 that the governor issued this past Friday, it puts in certain parameters with regards to facial coverings in enclosed public spaces. Obviously, whether you're going to the grocery store, whether you're going out in public, that is now a requirement under that executive order. Obviously, we're tracking it, not only the implications it has for our own county facilities, obviously for our first responders, for our public safety individuals, but what does it mean as far as the larger engagement that we have in public on everything from taking the kids for a walk, getting out to the grocery store, or just engaging folks in public. So very much all that information available at macombgov.org, but I think what we're going to be seeing is these masks are going to be more and more a part of our daily interactions.
Yeah, I think it's social responsibility. I think the bigger thing is just making sure people have an understanding that, if you're in close proximity to somebody, wear it. The confusion or that kind of, that forced compliance type of thing, I don't know that there's going to be police out there. And again, I would hope people aren't calling the police to try to get them to respond to, situations where somebody isn't wearing one in a grocery store or whatever. That's not really something the police need to be bothered with at this point in time. But again, people need to be somewhat responsible, making sure that they're wearing them.
Common sense and a calm perspective will go a lot further than some of this overarching, disagreements that folks have. Mark, you've talked about the balance, of the whole notion. Folks will go to the extremes on either side, but really with this, it's that common sense and engaging and taking that personal responsibility.
Yeah, the story of the one mother who has a sign, attached to her 5-year-old daughter walking through the store, and it says, this is my 5-year-old daughter. Please don't give me a hard time. I'm a single mother. I can't leave her at home. I can't leave her in a car, and is bringing her into the store. And even the girl has a mask on, but apparently somebody must have approached her and made some kind of a, inappropriate comment about it. So again, I don't think it's necessary. People need to kind of, calm down a little bit, not get too wordy with others, and understand maybe sometimes their circumstances, even if you don't. So with that, again, all of this is because of the numbers, and the numbers are still somewhat of a concern, specifically here in Macomb County. And what are those numbers?
Yeah, Mark, so over the weekend, numbers reached over nearly 5,300 cases in Macomb County with 528 deaths. Statewide, we are currently at 37,000 cases and 3,300 deaths. So again, numbers plateauing off. Just actually this past Sunday had one of the lowest occurrences of deaths that we've seen since mid-March. So a lot of these social distancing, stay-home parameters are actually helping bend that curve, flatten it out and everything. But again, each day we're going to continue to see these numbers arise, but all these safety precautions we're putting in place are having an impact on the spread of the virus around the community.
And not only is our health department noticing the numbers kind of like starting to plateau or flatten off, we're even hearing from our healthcare providers, our hospitals here. Just an article the other day in Macomb Daily they were talking about, and we have direct contact with our healthcare providers through our emergency management team. They're starting to realize, they're seeing less patients or less people coming in reporting concerns about COVID. So they're starting to open their doors for those non-elective surgeries, and getting people to come in to realize, hey, we've got room now, we've got space, and we're looking to kind of somewhat go back to a sense of normalcy to deal with people with other types of ailments in the actual hospitals themselves right now.
I think we've managed the surge, and I think that's probably the most refreshing thing when we look at those frontline hospital workers. Hearing some of the messaging from them, bringing individuals in to have some of those elective procedures gives the realization that the capacity is there. We're going to be able to meet that care, whether it is from a caseload perspective, obviously from the PPE and the coordination we've done through our Emergency Operations Center. Those things I think have been handled absolutely impeccably by the team that we have here, Mark, and it illustrates that cohesive response that we've had here in Macomb County and our ability to respond.
Well, and that's the thing. I mean, that was the immediacy, trying to figure out how do we get them those personal protection equipment. How do we get them masks? You know, they were looking for the face shields and they're looking for gowns as well, and even ventilators. But I understand, you know, pretty much anybody that needed a ventilator has gotten a ventilator. There's not been a concern regarding that here, specifically in Macomb County, but also we're meeting those demands, which is, you know, incredibly responsive on behalf of our emergency management by coordinating efforts with them. Even the first responders are getting what they need as far as allotments to take care of their issues. So that was the early on crisis and concern we had with not having a national stockpile. But fortunately, we were able to kind of help get that equipment to the folks that needed it right away. And that is not as big of concern right now, yet we're still trying to monitor that.
I think we've been able to respond to the community need. Mark, whether it's the 5,700 calls that our health department has fielded, whether it's the nearly 2,000 businesses that have been counseled, whoever has reached out to the county, we've been able to point them in a direction or get them a resource during these troubling times. That is going to be the standard in which we are going to operate for the foreseeable future. Whatever we need to do from our emergency operations center, whatever we need to do as far as updating the public here through these videos, you've given us the guidance, the leadership, the latitude to do so, and I think that's given us the continued pride to answer the call, whatever it is.
Interesting enough, and probably the last note on the hospitals, you know, what they're concerned about is they were finding that there were patients or people that were concerned about coming into the hospital because, you know, they didn't want to contract or get this COVID, that were showing signs or symptoms of possibly a heart attack or stroke, and that was very troubling to them. They found that there were some, you know, unfortunate stories that were out there because of people having those type of ailments, and they're cautioning people not to do that. If they're saying, you know, you have other health issues that could be life-threatening, you need to, you know, get that, seek that help from the hospital. So don't be afraid of doing that, because we heard apparently from the hospital officials that that was pretty much a concern for several cases as a result. So.
Mark, in the early onsets, it was the realization that folks were afraid to go into that enclosed environment with the contraction, the spread of the virus, and everything like that. I think the hospitals, as you highlighted, not only have figured out the most optimal way to manage it, but again, open up those operations to serve more and more individuals around the community.
Yeah, we're fortunate. The healthcare providers, again, there are heroes, but you know, they're trying to protect their own as well as protect the public. And you know, one of the sadder stories was during this time, people couldn't come visit some of those you know, patients in their hospital settings. And with that being said, there's some unbelievable stories out there, heartwarming stories on behalf of the staff over at these hospitals that are, you know, reading to some of these folks, you know, showing pictures from their loved ones that are being sent over to the hospital, singing, you know, sometimes, you know, reading scripture. I mean, it was incredible to see some of the things that some of these nurses were doing that isn't normally part of their workday function, but they felt compassion, they felt sorry for these folks that are in those hospitals, not being able to connect with loved ones. So they kind of, if you will, filled in to some extent for those folks. So credit to them. I mean, incredible, you know, not only the work they're doing, but the compassion that they're showing.
It's the compassion and care, Mark, and it's the same thing that we're seeing across the community. Obviously, with some of these new elements of the executive order, some loosening up with some of the other outlets, whether it's golf, which was a big one at the outset. Obviously, landscaping was another big one that folks were talking about. Boating and the impact that it has, obviously not only here in Macomb County with Lake St. Clair, but around the state. There's more outlets for folks to kind of take advantage of as we start breaking the weather here and getting into the springtime. That's going to be very important, not only to folks getting that level-headedness, but ensuring they're taking care of themselves, finding that personal wellness and well-being, and also caring for their families and having a few outlets as we get here into the summer months.
And that's a concern. The numbers, making sure that social contact is kind of limited because we know this, you know, the contagious nature of this, and people can transfer to one another. But it's interesting because you got extremes. You got folks that are out there saying, you know, shut everything down, and you got everybody else, you know, on the other side saying, hang on, you know, the economy is still important. So how do you middle that based upon facts, figures, data, information, and relying upon our medical experts and healthcare professionals? But it's difficult, and everybody sees it a little bit different. And so, you know, with that being said, governor's got to make some difficult decisions as to what's open, what's not, essential versus non-essential, and to put some restrictions or requirements in. Some people don't like that parental role, I guess, if you will, government telling them what to do. You know, they would like to have the data, the facts, and then try to make an educated decision themselves on how to keep themselves safe. So I think there's going to be a lot more tension going on as time goes on, and kind of a push to move in some other directions. You know, we're hearing, you know, the construction and the trades want to get back and doing some things. The people that are, you know, running some of these, you know, salons, you know, trying to figure out what they can do, or even people that are, you know, the dry cleaners, you know, people just coming in. So I think most of them, if we do start to move in that direction, understand that social responsibility, are going to protect their employees as well as the public and make their work environment safer. And I think that's going to be a thing, you know, kind of moving into the future. Not just the immediacy if they're allowed to do it, but I think you're going to see them taking these precautions, continuing to move forward, as we are going to do, even within our work environments here within the county government.
Mark, it's all about adapting. Obviously, we're looking at the whole implications of this new executive order and how it's going to impact our buildings, how we're going to have to screen individuals and employees, how folks can be monitored and come into our facilities and all those different elements. But even you look, those companies that have been open during even the majorities of these shutdowns, whether it's food pickups, whether it's curbside pickups, whether it's some of these, creative delivery services, these are things that businesses are putting into the mix, not only to ensure that they can meet the public demand, but also ensure public safety. So I think it's like you said, folks will argue on the extremes, but really coming together to figure out what's the need, how do we get that need, how do we respond to it, and how can folks continue to operate and engage each other in society.
And it's interesting because some of the legitimacy behind some of the concerns or complaints, and again, I'm not a golfer, so I don't really golf too much, but when you start to think about some of the restrictions, and some folks had mentioned that, we drive to a golf course, a buddy of myself, if we drive to the golf course in a car, enclosed vehicle, we get to the golf course and then all of a sudden now we can't be in a golf cart in an open area together and touching a flagpole, but yet they stopped at the gas station and used the gas holes to gas up their car. So it's kind of like, sometimes you wonder what is the big, I guess parental responsibility of trying to dictate everything they do at some of these locations. And I can see that. I can see the tension there. But with that being said, you're trying to figure out how do you balance this moving forward because we don't want to see a resurgence. So again, I don't have an easy answer for that. It's interesting just to kind of listen to the challenges that we're facing as a result right now of these orders.
Well, Mark, as a golfer, trying to figure out how it's going to impact my own game, obviously with my friends and family that I golf with. But again, it's the whole notion that all that information is going to be available and is on macombgov.org. You'll be able to read it, assess it yourself. There'll be information and guidelines out there should you have extended questions, how to reach out to the governor's constituent line, or if there's a specific state department that has licensing and regulation for that. Again, our Department of Planning and Economic Development has been guiding businesses, whether it was through that additional Michigan Small Business Relief Program, also the new parameters for the Paycheck Protection Program, which start off today, are available through macombgov.org. So again, we're meeting those needs, fielding those calls, and getting those critical resources to businesses.
Yeah, so any information you need about what's going on with this crisis or any other, responsive nature from county government, go to macombgov.org. There's plenty of information there to help you out, and again, to kind of inform you on what's going on with this crisis. So once again, John Paul and myself want to thank you for tuning in today and remind you to keep your family and yourself safe.